So this is using the BD finger pricker, slightly different, same principle. Clean the skin, make sure it's dry, like with the previous one. Take your finger pricker. This time you press it down. It doesn't have any little dots on it like the other one. Press it down firmly, and then press it against the skin, and it will go click. I have to say, from personal experience, this one doesn't seem to cause quite so much stinging and pain as the other one. Neither of them cause particular amounts of pain, but hey ho. Okay, so again, we need to take some blood down. There we are. We've got enough blood there. There's plenty of blood there for what we're doing. Then we bring the testing machine down. Remember, it can go in at almost at 90 degrees. It can go in at, try and avoid scraping blood. So we don't want that. If you start scraping off blood, it will give you a duff reading. Okay, so my reading on here, which is probably about half an hour after I've eaten lunch, is 6.3. So I've got my result. Do a bit of cleaning up. Don't want people bleeding everywhere. Okay, and the beauty of this is you can actually rid yourself of it by using the little trigger at the side and fire it into the sharps bin. The sharps bin, even though it's not sharp, it's as good a place to put anything. It's contaminated. It's something that needs to be destroyed in the furnace. Okay, so once you've got your result, if your machine will hold on to the previous result. If you want to press it twice, it should give you your previous reading, and again, that's 6.3, which is the timing here at 1:20 Now that you're going to need to document that reading, but before you document it, do think, is that what I was expecting? Was my patient or was my service user showing signs that it was going to be that? If you're expecting it to be 10 and it comes back as 4, could you question whether there has been an error in the reading? If you were expecting it to be 6 and it comes back as 14, again, could there be an error? Would there be a reason to do it again? Now, if there is a reason to do it again, that's probably where it comes in. So if you need to do it immediately after taking a sample and you need to do it again, it's usually because it's out of where you normally expect it to be for that person. If it's 0.1, 0.2, even 1 millimole difference, then okay, so somebody's normally their blood glucose is about 7. This time you've taken it, it's about 8, something like that. Now, that to me wouldn't give me enough cause for concern to have to repeat it, and especially if I was confident in the technique that I'd used. So you wouldn't need to repeat it unless it was kind of out of range. Like I mentioned earlier, if you had somebody whose blood sugar was normally around about 10 and then it comes back as something ridiculously low, like 1 or 2, the patient's talking to you and asking you what the reading was, that's telling me that there's probably an error in sampling.